Thank you for being here. I know you've got 1,000,001 things on your mind right now, things you need to do, so we thank you. Here on NBC just a few weeks ago, the Today Show opened up with images of people standing in long lines in Frankfurt in the heat, many crying, many desperate for their unemployment money. Is that a personal embarrassment to you to see that your state was featured in that way? And have we come very far since then?
Well, what we're seeing is this amount of unemployment, of people who need help all across the country. What I was willing to do was to open up an in-person facility in a way that got people help, even if it made me look bad. It was about putting servicing the actual needs of our people ahead of any type of approval or disapproval for myself. And I'm always going to keep doing that. What we've seen in unemployment is the perfect storm of what happens when you starve a system. You know, roughly 2.5, 3 years ago, the former governor eliminated half of our unemployment offices and let go of 90-something people that were processing claims.
But at that time, our unemployment rate, Governor, was one of the lowest in the country. Were those offices not needed?
Well, but when you starve a system, when things are good, you don't have the people in place when things are bad. A safety net is something that has to be invested in. For example, the system that is supposed to process claims was put into place in the year 2000. It needed to be replaced, 5, 7 years ago, and it didn't happen. But you know what? That's why we are where we are. It's my job to fix it moving forward. And yes, we have made a lot of steps. First, we are touring the state, opening on a temporary basis in-person unemployment services, which we haven't seen since the beginning of COVID. We've increased our state workforce from 40 people processing claims to 100 people, and we've entered into a contract where EY, one of the largest international consulting firms in the country, has already loaned us 220 people that are processing claims today. So we have more than tripled our workforce. We're going to have another 100 people by this time next week, and our goal is to get through all of the backlog claims of March, April, and May by the end of this month. We are taking action. We are going to give people the help they need. It's already taken too long, but we're going to get it fixed.
Everyone's concerned right now, of course, about the uptick in cases. What can we expect later today when you announce some new restrictions? Are you talking about rolling back some of the openings of, say, bars and restaurants, mandating masks in public places? What kinds of things can we expect?
Well, we're going to have to wait until the announcement this afternoon for those details.
That's right.
But what we are seeing is an uptick, although it is a slow uptick. But what we're seeing around the country, in Florida and Arizona, in Texas, is cases that go from the hundreds to the thousands to the multi-thousands, in a month or less. We are seeing hospitals overrun, ICUs being full. Now, we don't have that in Kentucky yet, but I am not going to let what is happening in other states happen here. I'm not going to let us get to that point. We have done better than just about any other state because we took aggressive action early, and then we reached a plateau where we could do more things and maybe had to have less restrictions. But now, when the challenge and the risk is increasing, you bet I'm going to take action to make sure we protect ourselves and each other.
Are you comfortable right now with the state's capacity of ICU beds that are not in use? Where do we stand on that?
So while we are seeing our cases increase, we still have significant capacity in hospital beds. We have a little under 50%. That's a very good number. In ICUs, we still have, I think, a little over 30%. That's a good number. And most of those beds aren't filled up with people with COVID. It's other issues at the moment, but we need space for those that might need an ICU because of the coronavirus. And the last one is ventilators, and we have almost 80% of those available. So that's all good. And our hospitals and our healthcare system is doing a good job. But what happens is if cases skyrocket, all that space gets eaten up very, very quickly. So we've got to take action early to make sure that we continue to have the capacity to help everyone that needs our help.
The trend nationwide is that most or many of these new infections are in younger people. Are you seeing that here? Is that the age group you are trying to target with your mandates and just your outreach?
Well, we are seeing nationally and in Kentucky significant numbers of people in their 20s and 30s that are getting the coronavirus, but we had a decent number of them before. I want to make sure that we're addressing everybody. You know, I'll admit that I went to a Little League game the other day. Of course, I'm wearing my mask because everybody's watching and it's the right thing to do. But when I looked around, we had a lot of people that are outside of that age bracket as well, not following the types of rules and regulations we need. This is on all of us. Yes, we need more buy-in for people in their 20s and 30s. Let's not pretend that there are others in other age groups out there that aren't doing their part. Remember, our actions impact people around us. We might be able to handle the coronavirus, but if we spread it to someone who can't, and if we had just taken a few more precautions, we got to think about that every day. We are our brother and sister's keeper during this virus. We've got to follow the rules every day to protect each other.
Lexington's FOP has expressed concerns fearing a mass exodus of officers in the current climate because many of them feel beaten up by the emphasis on the protesters and getting their voice out. While that's important, is government doing enough to let officers know that you have their back, that they are supported when they are out there doing the right thing?
Well, I think everybody wants to make sure that we have officers on the streets ensuring our public safety. I think we are just in a period of time where there is an opportunity for real dialogue from a portion of our state and our country that don't necessarily feel safer when there's an officer around. I think all of us want everyone to be better off and to feel better when police and state troopers and others are around. And if they don't, we need to get to the root causes of it. We need to address it, and we need to be better because of it. Yes, I support law enforcement, but I also support making sure that the voices of all of our community are heard and that their concerns are addressed. And sometimes it's that we are talking at each other instead of with each other. You know, I think the chief in Lexington is really trying to foster a real and lasting dialogue. And I believe that as opposed to getting disjointed right now, we've got a chance of a better future because of this. In the way that we engage in law enforcement, in ending systematic racism and injustice, I think we should all want to be better, and this is an opportunity to do it.
How can you reach out, though, to those individual officers and say, you have a say in this, you have a say in how we address this and get rid of systemic racism?
Well, what I've done primarily is to meet with associations, met with the FOP several weeks back when they requested the meeting, talk through a number of different items that are out there, listen to their concerns, as well as the fact that I listen to others. Now, my job is to build a better world each and every day that I can, and that's trying to build bridges, but also to push for improvement in everywhere we can. One thing we're doing is for the first time with training for most officers across Kentucky, we're doing training on cultural awareness, on understanding each other, on making sure that we can understand where people are coming from, because we believe that every officer can be better for it. And up until now, at our Department of Criminal Justice training, the only training offered on any of those topics was to dispatchers, and it was a very short course. Let's make sure we have the training out there to give everybody the means to do what they need to do. But there's sometimes that even in the course of this, when there seems to be disagreement, I think everybody's even saying the same things. I mean, officers will tell you that they have to respond to a lot of situations like mental health because we don't fund that mental health assistance that is needed that should be there instead of an officer. At the same time, you will hear from some of those populations that when an officer shows up, They wonder why there's not a mental health professional. We're all saying in some of these the same things. We want to get to the same place. We're just saying it a little bit differently.
Speaking of general mental health, a way to maybe redirect people's frustrations would be distraction. Many people want their fall sports back. We're worried about college football. We're worried about the Kentucky Derby. But the way some things are trending, for instance, the Ivy League has said they'll not have fall sports. Ohio State is concerned. They're talking about pushing the pause button. U of L had to push the pause button for the men's basketball team just this week. Do you expect we will have the Derby, we will have fall sports, and will we have them with spectators?
Well, right now we are on track to have those sports, but we see the virus in many places is escalating. The question will be, will the people of Kentucky and the people of this nation do what's required to ensure that we can keep it under control and to do these things? My goals are pretty simple. I want to protect the health and the safety of Kentuckians. I want to successfully restart and keep open this economy, and I want to open up our schools. Now, the biggest threat to not being able to do all of those things is us not following the rules, is us not being willing to wear masks, is us not social distancing from each other. We do all those things. We follow all these rules. We can do all of it. Goldman Sachs put out a statement the other day that if people would just wear masks, we would protect 5% of the GDP of this country. 5% of the GDP of Kentucky is $10 billion. So just look at that. $10 billion of our economy depends on our people's willingness to just do what it takes.
Regarding the election, we got through June. I think there was a huge sigh of relief from everyone there. But as we look toward November, are you making progress with Secretary of State Michael Adams on what our elections are going to look like, and when might we know?
Well, Secretary Adams and I have had a very good relationship. He deserves a lot of credit for even taking some risks that he may have faced politically that I wouldn't on the ways that we were able to conduct that election, and it was a success. Second largest turnout for a primary ever in our history. So we'll be meeting in the coming days, and I'm going to keep our conversations private because we've worked so well together, but I am certainly in favor of no excuse absentee ballots. That's voting by mail because this virus is still here. It should include early voting. Now, one thing we should do differently is have a few more polling locations, though I hope people understand that if we're able to do all of those other things, you might not have the same number of polling locations, especially when our poll workers oftentimes fall into the most vulnerable populations for COVID. But we had a huge success. So why would we not do the same things that created that success?
We're all getting surveys in the mail. How do you want your child to go back to school in the fall? And we've heard bits and pieces of different districts and their plans or their preliminary plans. But do you think Kentucky needs to be consistent across the board on how our schools open this fall, start dates, stop dates, and how we proceed?
We have provided consistent and strong guidance on how we believe schools can open and stay open safely. But people need to understand, I never closed schools. I recommended that they were closed, and each superintendent is vested with that authority. Now, there are going to be different situations in different places across the state that make that same type of structure, which is what it is under the law, that superintendents make those final calls, pretty important. A school system like the one I graduated from, Fayette County Public Schools, is very different potentially from a rural school system, for instance, in what you may be able to do or not do in busing. But here's what I believe, that in every school system, one size can't fit every student. If there are students whose parents do not want them to come back to in-person classes, they should be able to do full-time NTI that can be taught by teachers that maybe have an underlying health condition where it's not safe for them to come back to the class. Once you figure out how many students like that there are, you know how much you can spread out the remaining students in a classroom. Busing's the same way. We need to put out a call to every parent who can drive their kid to school, but maybe sends them on the bus for convenience to drive them to school. Once we know and have that commitment, we know how we can spread them out on the bus. There's going to have to be multiple options for individual students, because one student with very bad asthma isn't in the same situation with another student that doesn't have it in light of COVID and potential exposure.
This might be more suited for your lieutenant governor, but have you any concerns, or have you heard any possibilities of a staffing shortage when schools reopen? Are the teachers going to be there in the fall? Are all the support services, bus drivers, cafeteria workers? Any concern there that we just may not have enough people willing to go into that environment?
Well, we should have some concern for a good reason. That's that we should not be asking for people who have underlying health conditions that are at serious risk if they contract COVID to be coming back in person. We shouldn't be forcing that, but we should be providing options to where they can perform services that need to be performed, outside of simply coming in every day. But you know what educators are supposed to do? We're supposed to innovate. And I believe that schools can still manage what they need to manage if they simply figure out who they have, all their personnel, and what roles they can fill during this time, and that they be flexible and fluid in how they do it. I believe that if we do that, and if we're also servicing the children who will have different and special needs about who wants to do NTI and who doesn't, that we can find a good balance. But as always, we can make all the plans in the world. The one thing we can't control is COVID and its spread and how it spreads. So we're going to put the best plans in place. We're going to move forward, but we have to understand that there are times that we have to react to protect the safety of everybody out there.
We so appreciate your time today. Thank you, Governor.
Thank you very much.
If you're sure you don't want to give us a hint about that 4 o'clock, I just want to give you one last chance.
I think tune in and you ask some good questions that relate to it.
Okay. Thank you, Governor. Have a great afternoon.
Thank you.